Hey, it's Rav. I'm 7.5 months on T, 5 months post-op, and today we're going to be talking about what to expect at your top surgery consultation. Before we get into the main video, I'm just going to say a quick thank you to everyone who has been subscribing. I appreciate it so much. Thank you so much. We're now over 100. So I've actually finally been able to change my URL, and now we're going to be using youtube.com/RafiDeli. Also, I'm just going to get these fine details out of the way. The surgeon that I went with was Dr. Dana McKee, who is based primarily in the greater Vancouver area, and I had my surgery June 23, 2021. To get to my surgery, I went through 3 bridges. So I filled out the intake form to become the patient. I filled that out and got on their waitlist in February 2021. I had my intake appointment and my surgery readiness in March, and then I got the call from Transcare in April asking me which surgeon I wanted to go with. And after that, I had my consultation with McKee in May, and I had my surgery by June. So first of all, let's just quickly go over what the consultation is supposed to be for. Consultation essentially is so you and your potential surgeon can meet and figure out if you're the right fit for each other. Kind of like meeting in person for a first date after you match on Tinder. So the surgeon can get more information from you, especially like about your health and what your expectations are. And it should also be an opportunity for you to ask the surgeon any questions you may have and get more information from them. That said, what should you bring to your consultation, or what should you wear to your consultation? Generally, wear whatever you're comfortable with, wear whatever you want, but keep in mind that you're gonna have to take your top off. It is more ideal to have an outfit with a separate top and bottom, but if like you kind of have like a dress or romper or overall or whatever that can like be like just unbuttoned and like put around your waist and you like still have your bottom covered, then I think that would probably be fine. Wearing your binder to the consultation is probably gonna be like a-okay and totally fine, but I personally opted to go for like a more loose like sports bra kind of outfit because getting yourself in and out of your binder just takes way too long and it's so annoying, and I did not want to deal with like that squirming, scrambling like whole mess while I'm like nervous at the appointment. That's my advice personally. But if like your dysphoria just won't let you do that, that is also fine. Like just keep your binder on. One thing I highly recommend you bring is something that you can take notes on. Your phone will probably be fine, but if you're someone who prefers to write things down on a notebook, bring that notebook. But also there's this really nifty top surgery workbook that is on the Transcare BC website that you can download, and you can use that for like a guideline on stuff you're gonna need or like what to put together. Personally, because I am extremely extra, I printed it out. It felt good to have something tactile, something I could hold, where I could like write down stuff. It even has a section for when you're accessing surgery, like your appointment information, you can put that there. I mean, you know, you probably have it on your phone, but I kind of like writing it down. It also has like a really good section about what to expect at your top surgery consultation, and like some of the information that I'm covering in this video is like from this. It also has a really useful section that's like the frequently asked questions, so it has stuff that you could ask your surgeon. It also has like an other questions section, and that's where I wrote down like the other questions that I felt were specific to me that I wanted to make sure to remember to ask. Overall, this thing is a really good workbook, and it has like a lot of stuff also about like preparing for surgery and like some notes and stuff to keep in mind after surgery. I highly recommend getting this workbook. Even if you're not in BC, or even if you're not even in Canada, I highly recommend like just downloading the workbook anyway. Like there's of course a lot of stuff that's specific to BC and the system here, but there's also some good stuff in here that might be useful to you even if you're not from here. And in general, like it's a good idea to write down the questions before you go in for your consultation so you like feel a little bit prepared. Personally, I had quite a few questions that I wanted to be sure to ask, and like among those was, will I be able to walk my dog? She's this much weight, she's this size, she's this. Or about testosterone, like the testosterone form that I take is in the gel form, it's androgel, and so I was like, will I be able to put it on my shoulders properly? And he said that it would be fine, like the movement that you're limited to is like this way, but this is fine. And of course, if you wish to have a support person come in with you to the consultation, like a partner or a relative or whatever, it's a good idea to mention that with the surgeon's office just so they have an idea. And also, it's especially important with, you know, these panoramic times when they gotta keep track of who's coming in and out of contact with them. If you're from BC, bring your services card. If you're from somewhere else, get your like insurance stuff ready. Like you'll have to like double check on that and look into that. I personally can't say because I'm not familiar with what it's like outside of my area. So what exactly happens at the consultation? So after getting checked into the surgeon's office, they're gonna come in and talk to you. They're gonna ask you about your medical history, like get a better idea of your medical background, talk to you about the procedures that they've done before, what kinds of procedures that they do. They're also probably going to ask you a little bit about your gender identity, go over what your expectations are from surgery, maybe how long you've wanted surgery. So just be ready for that, and like just keep in mind that they're asking these questions so they can get a better idea of how best to serve you, and they're not there to judge you. After going over all of that fine detail stuff, they're gonna ask you to change into a medical gown, and they're gonna step out so that you can change. And if you have a support person with you, they can also step out as well if you prefer that they do, or if they've seen what's under there, they've seen that already, and you prefer to have them around, that's fine too. Whatever you prefer, just let the surgeon know and it's all chill. Once you're in the medical gown, the surgeon can come back in and they're gonna get a quick examination of your chest. They're gonna get a better idea of what they're working with. They'll probably do some measurements. They may touch and manipulate your skin and stretch it and try and get a better idea of what your elasticity is like. They will get your consent before they touch you and stretch your skin and things like that. And at this point, photos may be taken. It wasn't the case for me, but if they feel like they would like to do that, they will ask you first. After that physical examination, you are free to change back into your clothes, or you can just vibe in the medical gown until the end of your appointment. Now that they've gotten a good look at what they're working with, the surgeon will be able to talk to you about what procedures you are eligible for, and also they might flag any additional extra things that they have noticed based on what they've seen. So in my case, Dr. McKee made it a point to mention that my scars would most likely be connected scars because of how close my breast tissue was to each other. And also because I was a bit heavier, and honestly I still am, he mentioned that additional liposuction may be recommended. So while the actual surgery itself was covered by MSP, the liposuction, the extra liposuction on my armpits and stuff, that was not covered by MSP, and I paid for that out of pocket. And from there we went over the aftercare instructions, and in my case, because I work from home and it's a really chill desk job, he said that I could be back at work in a week or even 3 days if I wanted to. So when I asked for time off work, I asked for a week and a half, but probably I could have been back at work after half a week, after 5 days or so, because I was pretty bored after 5 days. But keep in mind, that's just me. We all heal at different rates, our bodies heal in different ways. And so after going over all of that, they're gonna give you an opportunity to ask questions, so ask away. At this point, you can also mention any preferences you might have, if you want no nipple grafts, or if you do want them, or if you want them slightly bigger or placed slightly differently, you can mention that at that point. But also you will have to go over it in more detail anyway on surgery day itself. The surgeon in some ways will be limited to what they have to work with on your body itself. So because of the kind of anatomy I had, my scars do curve a little bit more. And like I said, I have connected scars, and honestly, that's fine. I'm kind of into them now. Initially, when it was first mentioned, I was a little bit apprehensive, but at this point, I'm pretty happy with them. I really like them, and as I get more fit, because I feel like I am starting to get more fit, they're gonna turn into some really nice pecs. Hopefully, at the end of the consultation, the two of you and your surgeon can decide from there if you feel like it's a good fit and you can move forward. Or if you're still having second thoughts, you could probably book a second consultation, or you could go and shop and visit other surgeons and get consultations with them, and then get a better idea of which direction you want to go. And in some cases, you may be able to book your surgery day at the end of your consultation, or the office may call you later on. And now for a more specific question, which is, what was Dr. McKee like? When I went in, I was I was uncomfortable myself. I was a little anxious, I was a little nervous. But when I'm nervous, my go-to is to crack jokes and to lean into the awkwardness to make it funnier. And he actually rolled with it. I was joking about how I wanted a souvenir, how dentists give you your tooth after surgery. I wanted my tissue after surgery. And he was yeah, because you asked that question, we're gonna deny you surgery. And it was actually a funny joke. I know some people may not jive with that, but I personally found it hilarious, and that's my sense of humor, and I think he got a read of that. And even on surgery day, when I showed him the cast that I made of my chest, he was like, yo, if you have a business card, give me that. I'll send it to all of my clients. I'm not sure if he was actually joking or if he was serious. I think he also matches your energy a little bit, so if you come in feeling really nervous and quiet, he might be quiet as well. I just think he'll open up if you do, you know? Also, he has pretty much the shortest wait list in BC. That's why a lot of trans people tend to have McKee as their surgeon. He does just this surgery. He doesn't do a lot of other surgeries. He puts most of his focus on gender affirming top surgery, and that's why he has so much time to see so many of us. That said, he does have a BMI limit, but I do believe he's a little bit flexible. I think the BMI limit is 33 or 34, and I'm literally that, and I still got in. And I think there are a few heavier folks that also got with him, so it kind of depends. I'm not quite sure what it depends on. Might be just a good idea to talk to Transcare when you get that call. So I hope this video was useful, entertaining, interesting in some way. I really appreciate you watching. I appreciate you watching until this point. My next video is going to be my 8 months on T video, so that's going to be an update video that I'm going to be posting next week. And after that, my next video that I'm planning to do was preparing for surgery, like the tips and tricks and stuff like that to get yourself in as good of a spot as possible. Or if you want to see a video about like the different kinds of surgery, I can go over like that kind of thing. Which do you want to see first? Let me know. Hit me up in the comment section or hit me up on social media. Let me know. Love to hear from you. Yeah. Bye.